Unfortunately, the 80% of women affected by an ovarian cancer are diagnosed at advanced stage when the disease is already extended in the pelvic and abdominal cavity. There are several independent prognostic factors of women affected by an advanced stage ovarian cancer, but the only modifiable prognostic factor is the surgical cytoreduction. That means the surgical removal of all the macroscopic disease. And this means to perform several surgical procedures at the same time in the same patient, including radical removal of the internal genital organs, but also to perform diaphragmatic surgeries, liver surgeries, removal of the spleen, pelvic and aortic lymphadenectomy, etc., etc. So the surgical procedure used to be very complex, and we need to be we need to be very well prepared for perform the whole procedure. In any case, we need to work in a surgical multidisciplinary team. Not only this needs to be led by gynaecological oncologists, but also we need to work joint with general surgeons, anesthesiologists, etc., etc.
So how many women with ovarian cancer are able to have this type of surgery?
There is a problem because we have a non-centralized system of care. That means that virtually all general surgeons, obstetrics and gynecologists, or gynecological oncologists can operate on this type of patients. This can perform this type of very complex surgical procedure instead of refer this patient to an specialized surgeon. It is very well demonstrated that gynecological oncologists can offer the best quality of care for women affected by an advanced stage ovarian cancer. But also, this gynecologic oncologist needs to work in a multidisciplinary unit, in a referral hospital. In this way, we need to offer the best quality of care for these affected women with advanced stage ovarian cancer. And this multidisciplinary team we need to also work joint with medical oncologists, radiotherapists, radiologists, medical oncologists, and psycho-oncologists, etc., in order to offer the best strategy of treatment for each individual case. Unfortunately, there is a recent study published in the United States demonstrated that only 4% of women affected by an advanced stage ovarian cancer receive treatment by a high-volume surgeon in a high-volume hospital. The vast majority of these women receive treatment by a low-volume physician in a low-volume hospital. And it is also very well demonstrated that when surgery is performed by a gynecological oncologist, patients live significantly longer period of time. So we need to review the policy of doing this type of surgery, and probably we need to establish in each individual country or worldwide an adequate policy of referral this patient to a specialized institution with well-trained surgeons.